Did you know that accidents can happen anywhere, anytime? Even at work, where we spend a big chunk of our day. Think about it. A slip on a wet floor, a burn from a hot coffee spill, or even a sudden medical crisis. These situations can escalate quickly, and having the knowledge and skills to provide basic first aid can truly make all the difference. When emergencies strike, every second counts. Having basic first aid training empowers us to act swiftly and confidently, providing immediate care to those in need. First aid isn't just about bandages and antiseptic wipes. By learning some simple yet effective first aid techniques, we become equipped to handle a wide range of workplace incidents. Knowing how to control bleeding, treat a burn, or provide assistance to someone who is choking can significantly impact the well-being of those around us. So let's dive in and explore some essential first aid procedures that every employee should know. Burns. They're a common workplace injury, especially in environments with heat sources or chemicals. Before jumping into action, always remember the first rule of first aid. Your safety comes first. Assess the situation and make sure the environment is safe for both you and the injured person. Once you've confirmed the scene is safe, approach the injured person and ask them what happened. When it comes to burns, the first and most crucial step is to cool the affected area. Start by gently removing any clothing or jewelry near the burn, but avoid pulling or tugging on anything that's stuck to the skin. Once that's done, it's time to cool the burn with cool, running water for at least 10 to 20 minutes. Avoid using ice or ice water, as these can actually damage the delicate tissues and worsen the injury. After cooling the burn, cover the affected area with a sterile, non-stick dressing. Avoid applying any ointments, creams, or home remedies to the burn, as these can interfere with healing. Once you've provided basic first aid, it's important to seek medical attention for the burn. Even if the burn seems minor, it's always best to err on the side of caution and have a healthcare professional assess it. Cuts and scrapes, they're like uninvited guests at a party. They can show up anytime, anywhere. In the workplace where sharp objects and potential hazards lurk, these minor injuries are pretty common. The good news is that most cuts and scrapes can be handled with basic first aid right there in the workplace. Before tending to your coworker's injury, make sure the area is safe and free from immediate hazards. If the cut or scrape is bleeding, your first priority is to control the bleeding. Start by gently cleaning the wound with clean water and a mild soap. Once the wound is clean, apply direct pressure to the area using a clean, sterile dressing or a clean cloth. If blood soaks through the dressing, don't remove it. Simply apply another layer on top. Once the bleeding is under control, it's time to dress the wound. Apply a thin layer of antibiotic ointment to the cut or scrape to help prevent infection. Then cover the wound with a sterile bandage or gauze pad, securing it in place with medical tape. Encourage them to keep an eye out for any signs of infection, such as increased pain, redness, swelling, warmth, or pus discharge from the wound. Picture this. You're walking through the office, rushing to a meeting, when suddenly you hear a gasp and a thud. Your coworker, who was just moments ago discussing their latest project, is now on the floor, clutching their ankle and wincing in pain. Sprains, which involve the stretching or tearing of ligaments, often affect the ankles, knees, and wrists. Start by making sure the scene is safe. Once you've confirmed the area is hazard-free, approach your coworker and gently inquire about the incident. When it comes to sprains, the first 24 to 48 hours are crucial for minimizing pain, swelling, and inflammation. And luckily, there's a handy acronym to guide your first aid efforts: RICE, rest, ice, compression and elevation. Rest. Encourage your co-worker to stay off the injured joint and avoid any activities that cause pain. Ice. Applying ice to the injured area helps to constrict blood vessels, reducing swelling and numbing pain. While RICE is an effective first aid approach for many sprains, it's essential to recognize when the injury requires more than just home care. If your co-worker experiences intense pain that doesn't improve with pain relievers, inability to bear weight on the injured joint, or numbness or tingling in the injured area, seek immediate medical attention. A healthcare professional can properly diagnose the severity of the sprain, rule out any fractures or other serious injuries, and recommend the appropriate treatment plan. By staying vigilant, providing prompt first aid, and knowing when to call for backup, you can help your co-worker navigate the road to recovery from a sprain with confidence and support. Imagine this. You're having lunch with co-workers, sharing stories and enjoying a much-needed break. Suddenly you notice someone at a nearby table frantically clutching their throat, their face turning red, their eyes wide with panic. They can't speak, they can't breathe, they're choking. In the workplace, where we often share meals, snacks and laughter with colleagues, choking incidents can occur more frequently than we might realize. Recognizing the signs, is someone choking? Choking is a scary situation, both for the person experiencing it and for those witnessing it. Recognizing the signs of choking early on can be life-saving. The universal choking sign, one or both hands clutching the throat. If you see someone clutching their throat, ask, "Are you choking?" Remember, every second counts. The Heimlich maneuver, a life-saving embrace. Recognize the signs. Someone is choking and needs your help. Perform the Heimlich maneuver to dislodge the object and restore breathing. Think of it as a powerful bear hug to help them breathe again. Use abdominal thrusts to create pressure and expel the obstruction. Continue until the object is dislodged and they can breathe. Section 1. CPR. The rhythm of life. Imagine this. You're walking through the office when you notice a co-worker collapsed on the floor, unresponsive and not breathing. Your heart races, but one thought cuts through the noise. I need to do CPR. CPR is a life-saving technique that can make all the difference in a medical emergency. It's like jump-starting a stalled car. You're manually keeping the blood flowing and oxygen circulating. Remember, CPR is about taking action, about being someone's lifeline when they need it most. Section 2. Assessing the scene. Is it safe to approach? Before you rush in to perform CPR, remember the golden rule of first aid. Your safety comes first. Just like a superhero wouldn't fly headfirst into a burning building without checking for hazards, you need to assess the scene and ensure it's safe for you to approach. Start by surveying the area. Are there any immediate dangers like spilled chemicals, electrical wires or falling debris? If so, address those hazards if it's safe to do so, or move the person to a safer location if possible. Remember, you can't help someone if you become injured yourself. Once you've determined the scene is safe, approach the person and check for responsiveness. Gently tap their shoulder and shout, "Are you okay?" If they don't respond, it's time to call for help. If you're alone, shout for help to attract attention. If someone responds, ask them to call 911 or your local emergency number immediately, and to bring an AED, automated external defibrillator, if one is available. Having someone else handle these tasks allows you to focus on providing immediate care. Remember, time is of the essence, and every second without oxygen can cause further damage. So, while you're waiting for help to arrive, it's time to start CPR. Section 3. Chest compressions. Your hands, their heartbeat. With the scene assessed and help on the way, it's time to begin chest compressions, the cornerstone of CPR. Think of your hands as the engine keeping the blood flowing, delivering oxygen to the brain and other vital organs. First, position yourself correctly. Kneel beside the person with your knees shoulder width apart. Place the heel of one hand on the center of their chest, just below the nipple line. Place your other hand on top of the first hand, interlacing your fingers and keeping your elbows straight. Body positioning is key. Position your shoulders directly over your hands, ensuring your body weight is used to deliver the compressions, not just your arms. Next, compress the chest. Press down on the chest at least 2 inches deep for an adult. Allow the chest to fully recoil after each compression before pressing down again. Aim for a rate of 100 to 120 compressions per minute. To help you maintain a consistent rhythm, think of the beat of the Bee Gees' song Stayin' Alive or Queen's Another One Bites the Dust. Yes, you read that right. These catchy tunes have the perfect tempo for CPR. Continue performing chest compressions until emergency medical services arrive and take over. The person shows signs of life, such as breathing or movement, or you are too exhausted to continue. Remember, CPR is physically demanding, and it's okay to switch positions with someone else if you get tired. The important thing is to maintain continuous chest compressions until professional help arrives. Section 1. Every second counts. The power of preparedness. We've journeyed through the essential skills of workplace first aid, from treating burns and cuts to mastering the Heimlich maneuver and CPR. But knowledge without action is like a car without an engine. It's not going anywhere. In those critical moments when an emergency strikes, it's our ability to respond swiftly and decisively that can make all the difference. Remember, time is of the essence in any first aid situation. Every second that ticks by without intervention can have a significant impact on the outcome. Think of it like a race against time. The faster you act, the greater the chances of preventing further injury and promoting a positive recovery. But preparedness goes beyond simply knowing what to do. It's about cultivating a mindset of readiness, a sense of confidence that empowers us to take charge when it matters most. It's about transforming from a bystander to a first responder, from someone who watches to someone who acts. And that transformation begins with embracing the knowledge and skills we've explored together. Section 2. Your first aid arsenal. Building a workplace safety net. Imagine a workplace where first aid is more than just a box tucked away in a corner, forgotten until a mishap occurs. Imagine a workplace where every employee is equipped with the knowledge and skills to respond confidently in an emergency, where first aid is woven into the very fabric of the work environment. That's the power of a proactive approach to workplace safety. Creating a first aid-ready workplace starts with ensuring that every employee has access to basic first aid training. Just like fire drills and safety briefings, first aid training should be an integral part of employee onboarding and ongoing professional development. But it doesn't stop there. A well-stocked and easily accessible first aid kit is another crucial element of a comprehensive workplace safety net. Think of it as your first aid arsenal, equipped with the tools you need to handle a wide range of emergencies. Regularly inspect and replenish the contents of your first aid kit to ensure that supplies are readily available when you need them. And don't forget to familiarize yourself and your co-workers with the location of the kit and the contents within. Section 3. Be the workplace hero. Embrace the power of first aid. As we conclude our exploration of workplace first aid, let's shift our perspective from knowledge to action, from theory to practice. Remember, first aid is not just about bandages and splints. It's about human connection, about being there for someone in their moment of need. It's about channeling our inner superhero and using our skills to make a real difference in the lives of our colleagues. Embrace the power of first aid, not with a sense of fear or obligation, but with a spirit of empowerment and compassion. Think of it as a gift you give not only to your co-workers, but also to yourself. The gift of confidence. The gift of knowing that you can handle an emergency. The gift of potentially saving a life. So, the next time you're at work, take a moment to appreciate the importance of first aid. Share your knowledge with a colleague. Advocate for a well-stocked first aid kit. Be the one who steps up when others hesitate. Because in the realm of first aid, we all have the potential to be heroes, to make a difference, and to create a safer and healthier workplace for everyone. Remember, it's not just about what you know, it's about what you do with that knowledge.